all of this moves as a unit, right? So if you just have a really bad neck, and I'm talking to anybody out there that has it, doesn't like their neck, you also probably can't just do the neck, right? You have to do everything move along the whole jaw, the whole everything together. Also, probably can't just do the neck, right? You have to do everything move along the whole jaw, the whole everything together. And then also, I want you to touch on this too. You had talked to me about you can't just do this. You also might get a pucker here, so it has to move as one unit. What do you say about that?
That's exactly it. It has to move as one unit because it is one unit. So if you remember, we talked about layer three of the face. So that's our fascia in our temple. That is our smaz muscle of our face. And that is our platysmal muscle of our neck. So we know that those age together because they are all interconnected. So if we want the most long-lasting and most natural looking result, then you're going to address them all. So as an example, when we lift a neck, okay, or we address a full neck over here, you can address it in two vectors. The vectors are tightening it here in the midline, so that's putting
Hmm.
the muscle back together. That's a platysmoplasty. You can absolutely pull it laterally over here. But the problem is that you're basically tightening a belt against a beer gut. Things are going to overhang. And
Oh,
the
so you might
result,
get jowls, you're saying. This could
it
just
might, it won't get jowls, but it might accentuate them. And
accentuate.
it certainly won't treat them, but it also just misses the mark on the proper way to treat the neck. Because if you don't pull it in the third vector, and the reason why we have a full neck is because our face has fallen. So if you don't pull it up vertically in that third vector, like I'm showing you here,
Hmm.
the neck's going to fail. Okay. Now, there are some circumstances in younger patients who have a lot of genetic neck fullness. Say they have, a very weak muscle for whatever reason, they have glands that are just coming through. Those people might be candidates for isolated neck lift surgery. I will do a handful of those a year. And it's because, I can't reason doing a face and neck lift in somebody in their 30s. We can go
I
back
was,
to that topic.
yeah, I would like to because we
Yeah.
didn't really answer that one yet.
That's right. That's a
Yeah. So
whole
just
topic on
just so
itself.
people know, this here, this is
That's right.
platysmal, and see, mine are separated.
That's right.
But if
That's
you
the De
fix
Niro
it,
muscle.
then you would do this together, right? Wouldn't you sew this together or something?
Exactly. Yeah. So, it's the two sheets of muscle that basically meet in the middle. So it starts really right over here. Your face ages like a pendulum. So if we start to have gravity effect, it doesn't fall straight down onto our nose. It falls along the ligaments that are guiding that level three of your face. So it falls along a pendulum towards the middle of the neck like this. So in order to reverse that process, it speaks to that vertical lift we're referring to, where you're not lifting just backwards. You're not lifting towards the incision line of the ears. You're lifting back up towards the mid portion of your forehead, right?
Ah, so that's why they don't
It's,
like you to look in the mirror and go this. They want
that's
you to
right.
go this a little
Exactly. Yeah.
higher.
Every woman does that when
When
they
I go
look in the
sit at a
mirror.
table with people, this is what I do now. I just kind of
There
go,
you go.
hi, and I just
Yeah. Yeah. I mean, you said that you were 60 at the beginning of this, and I put that in my pocket to maybe bring up at a later date. But Mary, you look incredible for your age. I operate on many women in their 60s, and we don't have to get into this, but whatever you have done has been working for you. Small things over
thank
a
you.
long period of time make a massive difference, and genetics, frankly, plays into this more than
Yeah,
anything else. There's no
yeah,
question, right?
yeah.
Um,
But thank you.
so
But back
yeah,
to so is there an age where you're gonna go, I'm sorry, you're just too young. That's just not it's just that's too young.
yeah. I think we've lost the plot a little bit. And this is, we're falling victim to the indication creep that a lot of the non-surgical providers fell for when it came to fillers and Morpheus that we talked about at the beginning. Too much of a good thing is not better. Doing a facelift on a young person who probably doesn't need it is, in my opinion, it's medical malpractice. I have operated on people in their 30s, one person in her 30s, and she had a connective tissue problem and she had lots of skin laxity. She lost 100 pounds, I think, twice in her life. And her surgery went great. There was nothing wrong with that. But there is a different layer, It's layer six of the face. That's inside. That's the brain, right? That's the most important part of the anatomy that
Yeah.
sometimes we fail to recognize as surgeons, where there's got to be something else motivating a girl in her 30s to come and have facial
Do you think
rejuvenation
it's
surgery.
filters, social media filters? Is it,
It's a whole bunch of, it's everything. It's everything
celebrity?
and anything. Surgeons online who have a presence like I do, we're probably our own worst enemies, right? Because we talk about how great our jobs are and how there has never been a better time to have a facelift, and we show incredible results. And then somebody who is targeted by that algorithm will think, he's got to be talking to me. I see those things in the mirror. And despite our best attempts to help people, sometimes patient selection is like the most important thing when it comes to facelift surgery. And I fully am aware and I recognize that I live in this bubble that, you know, all I do day in and day out is I talk about facial plastic surgery and facelift surgery. But there is more to the world and there is more to life than just how we look.
Yeah.
And I
The
think
vanity portion of it is just,
that's right.
and I do think social media drives a lot of that. And also, I wonder how you, what do you say to those people who, or to anybody, even patients and you as the doctor, that say, like, are you so vain, like to even want to get your neck lifted or your face lift or, like, aren't you happy enough just who you are? Like that criticism is like, if I look at people online who have gotten work done, then you look at the comments, some of them are really mean and they'll be like, oh,
Yeah,
you must be so, not confident with yourself. And why don't you just look inside than outside? Like, what do you say to
right.
those people?
I say those people, most people are who they accuse other people of being. So if they're telling you that you are vain
That's
and not confident, then they're probably just, projecting and reflecting how they feel on the inside if they feel so empowered to say something anonymously online. So I'm bothered much less by that. I think for me, it's important to factor in the person in front of me. And, when I'm assessing a patient for facelift surgery, this has happened a number of times in my career where I'm just not sure if they have the right motivations. And I ask them straight up, how is this going to change your life? And if their answer to me is, I really hope this makes me a happy person, and I hope it helps me get the job, and I hope it helps me find the right partner, then I know that their motivations are misguided.
hmm
And it's not to say that you know, there's something wrong with that person. But I know, having done many of these surgical interventions over the course of my career, that surgery doesn't make people happy,
Right.
right?
That's interesting.
Surgery makes happy people happier. It's because those people have done the work outside of their appearance. They feel good on the inside. And all they want is to focus less about why there is some disconnect between how they feel and how they look. And the truth is, although we get tons of selfies from people all over the world after having their surgeries done, we know that they are not staring at themselves in the mirror over the course of their recovery and well beyond that period. They're actually looking less in the mirror. They're taking less photos because
That's beautiful. Yeah.
they care less about how they look because nothing bothers them anymore. And so those are the best candidates to select for surgery. It's being one part of the puzzle. Like I'm so interested in holistic care for my patients and really how facelift surgery is part of self-care, but it's not the only thing. This is my bubble that I live in and this is what I
Yeah.
can help with. But if you have not done the work outside of, you know, the vanity part of it, then the
Right.
vanity is not
Right.
going to make you happy. So this is a very complex subject that we have conferences
Yeah.
on alone. And I'm still working through how to choose the best candidates for
I love
surgery.
that you
And
do that. Like you're not just a person who, they put the down payment down and you're like, okay, and you're just doing them, 2 or 3 a day. You do
mhm,
one a day if you and then I don't know if it's every day all week, and I'm sure you have consult days as well, but you're very
yeah.
selective as to who you will operate on.
hmm As we have gotten busier in the practice and the leads have increased from many different avenues, mostly from social media, we're essentially turning away 80% of people even before they come in for consultation.
Wow.
We're and we're turning away about 40% of people even after they have had their consultation. And again, it's not me saying that you are a bad person and that I don't want to be involved in your care. It's just this combination of experience and your anatomy, your expectations, and my ability to bring that all together. My technical expertise has to match your expectation, and your anatomy has to reflect the technique that I use. And so until those all kind of align together, it takes a lot. It's a very extensive screening
But that's
process to
integrity.
determine if
That's
somebody's going
integrity.
to be a good candidate for it.
Yeah, but that's integrity, and you have
Thanks.
that.
Thank you.
I
Yeah.
want to talk about AI because I know in my business, in the TV business, entertainment business, it's scary. I mean, AI is
Hmm.
taking all the, I write, so writing has now become, very difficult because everybody's using AI. So your creativity is a little bit stifled at that point because everybody else could write
Hmm.
better now because they use AI. What is it? How is it affecting your business? And does it help
Hmm.
you? Is there a way that AI is something, a tool that you can use in the future?
It has helped me as a doctor. I'll start off by saying that. So we actually have an AI scribe in the clinic. It takes all the notes for us. It summarizes them in ways that I couldn't in the past, and it saved me literally thousands of hours of paperwork. We deal with patients who might have body dysmorphic disorder, and if I'm not sure, I can literally prompt our AI scribe to say, based off of my conversation above, are there any red flags for body dysmorphic disorder? And it's picked it up a couple of times.
No
Yeah,
way.
it's pretty cool. Yeah. And if I am asking it that question, then I have my own suspicions, of course, already. And it's just very good. It uses a whole slew of I guess
Be like, run,
algorithms and
run
prompts
from
to do.
this
Yeah.
patient, doctor, run.
Yeah.
This person
Yeah.
has a problem.
Yeah. In fairness, we only prompt it when I'm concerned about that as a diagnosis, which is pretty rare, frankly. Um, AI
Will
is kind of
AI
this.
help you in the future robotically, like in surgery?
I don't think AI will have any positive benefit on plastic surgery. And the reason
Oh,
why I say that is because plastic surgery at its core is actually about deception, right? We want to deceive people into thinking that we might be younger, that we might look better, more youthful. Um, and when it's done well, that deception works very well, right?
yeah.
But I think that those people who perform the surgery or those people who elect to get that surgery might take that deception a little bit too far. It's like a secret that you don't want to let out.
Yeah.
And, you know, it's not everybody, and it's certainly not the vast majority, but there are some surgeons who use deception not just in surgery, but in the way that they market themselves. And I don't like that.
I don't like it
And
either.
I think that AI is only going to help that type of person. I think that it will help them enhance their results that they put out there. I also think that in the past, where as patients would use like filtered versions of
Oh
themselves,
yeah, I never thought of that. You mean like some of
yeah,
these before and afters could be altered. Oh my God.
correct. It's very scary,
Oh
right?
shite. Yeah.
Um, I think that patients are no longer using filters. They're using like AI avatars to say, this is what I want to look like because they think that, deception is the name of the game. So it's got to be true. You have to be able to create that in surgery. And so I think it's an important conversation to have. And I've thought a little bit about it as far as what are going to be the benefits. What does the future of plastic surgery look like in a world of AI? And like with everything, jury's still out. I think we have to decide what are the positives that we can use in our practice and where we need to start educating people and cautioning them about how AI can be used to deceive, just like plastic surgery, when done very well, can also deceive. That might be a positive,
Hmm.
depending on who you ask.
I wanted to also ask you about men because
Hmm.
my boyfriend asked me that to ask you that question because he said, especially he's an actor and not that
Yeah.
he wants to get anything done, he doesn't need anything done. But um men and do you find that men are starting to jump on this bandwagon more than they used to? And is the outcome is good as for women?
Yes, I would say that in the last 3 to 4 years, the proportion of men in my practice has increased from 5% to probably 20%.
Wow.
So we're seeing a huge increase in men seeking facial rejuvenation procedures, mostly because of their necks. That's the big thing. So I do a lot of surgery for politicians and businessmen who wear very high collared shirts, and they find that their turkey neck hangs over that collar when they wear it tightly. So our goal is not to transform the way that they look or make them look any younger. The sole purpose is to treat the neck and to make sure that it, matches the collar that it's sitting on, basically.
The damn neck.
The
I
damn
can't.
neck.
Why is this damn neck always a problem? Even in men, of course, they get
Yeah.
the neck is so thin. It's like the the skin is so thin, right? I think it was
Well, for you it is.
a god flaw to make the
I've
neck.
been I've been in many necks that don't look like yours, and they are heavier necks and they are deep set necks. And frankly,
Oh, that's true. Yeah, yeah.
that's how you can differentiate a really good surgeon from somebody who's just kind of going through the motions. But the best facelift results, you can tell by how good the neck looks. That's the truth.
When you lift the neck, does it also somewhat lift this, like the rest?
It should.
Yeah,
So it's
that's
not,
plus.
yeah, it's not a breast lift. It's maybe a chest lift, but it really does treat the skin. And this is, by the way, we never really talked about it, but this is one of the biggest benefits of preservation lifting. So preservation face and neck lift is essentially a modification of the deep plane facelift. So if you can recall, we talked about how we only go through layer 1 and 2 of the face. That's the skin and the subcutaneous fat to get access to the muscle.
Mhm.
But in that layer, in layer 2, that's where we see many of the earlier term complications from facelift arise. That's where we have the blood vessels that can spread a leak, forming a hematoma. That's where we have blood vessels that we need to heal the skin that might not produce enough oxygen that could cause some tissue damage. That's where we see little irregularities or just skin that's not healing very well altogether. So enter preservation face and neck lift. It's basically the amalgamation of the work of 6 surgeons all around the world, from Beverly Hills to Milan, Italy, to St. Louis, Missouri, to uh, Tunbridge Wells in the UK. Basically, all of us got together. We essentially noticed that there were small modifications that we each alone were doing to the deep plane facelift. We put them all together, and that's how we essentially came up with the preservation facelift, which is a term coined by Mike Nyack in St. Louis, who's a hero of mine. So, what is preservation? What are we preserving? We're preserving layer 1 and 2 of the face. So essentially, we are getting into layer 3 and 4 quicker. We're no longer peeling as much skin in order to get access to the muscle, so that by the time we've lifted up the muscle and we put it back into its appropriate position, most of the skin that we have lifted for access is now removed. So all of those
So
complications
you cut it
related.
away. You basically cut it away.
Exactly. Yeah. So all of that, all that skin that potentially could have led to those early complications is now gone. It's out of the equation. And we do something similar in the neck where we're dissecting far less skin in that area. We're dissecting just a small pocket here and a small pocket here. We keep a little patch of skin and muscle attached over here so that, when we try to lift our neck, we're not pulling from back here. That has zero effect whatsoever. We pick it up over here just like you did, and we lift it up like that. And that's because we get a lot of support from our skin to our muscle and vice versa. So in keeping this patch attached over here, we have never seen better results when it comes to the submentum or that area underneath here, because it's basically like adding a load-bearing wall in the middle of a room.
Ah,
You're supporting the skin from here as opposed to supporting the skin from back there. So that's why we see better long-term results with this technique as well. And when we wrote the paper a year and a half ago, it was widely accepted by tons of surgeons. And now, we know this for a fact because we're part of this group. There are thousands of surgeons around the world who are using this modification in some way, shape, or form that has, benefited them, but has benefited thousands of patients. So you know, it's an honor for me just to be included in the group of surgeons that helped publish the paper, but it's really satisfying to know that it's helped so many people.
so people come from all over to come and see you in Toronto. How long or what is the amount of time? Like, let's say somebody lives, in California and they want to come and see you, what would you recommend is like, how long would they have to be in Toronto to have you be their surgeon? And would they be required to come back a couple times, or how does that protocol work?
For sure. A vast majority of my patients come from all around Canada and the US. So if it's a shorter term flight, in general, we want you to stay in town for anywhere between 8 and 10 days. And, you know, major complications happen usually in the first 48 hours, but they can happen well after that. And our goal is not to avoid you from having any type of complication, but to ensure that all of the major ones that might occur are now out of the equation.
Right.
And so we see you often. We might treat your skin. We might help with a little bit of swelling. And of course, we're taking out stitches, in multiple sequences and over the course of the first 10
So they're not
days.
dissolvable stitches. You have to remove them.
Correct. Yeah.
Okay.
And then international patients need to stay a little bit longer. It's at least 2 weeks. I've had patients stay in town for a month just to be on the extra safe side. And this is again, if you're on a long haul flight, the last thing you want is to call
Yeah.
for a doctor, because I think there was a story of a woman who, they said her face exploded on the way home from Turkey, and it didn't
Oh,
explode. Probably what
no.
happened was that she had a hematoma that popped through an incision line that was still very fresh. And so it looked like an explosion, but it was just probably somebody who gone on a plane a little bit too soon after a major surgery.
Yeah.
And I'm sure lived to talk about it. But those are things that we just don't want making the news for our
Well,
patients.
you swell anyway when you get on a plane for a long flight, regardless of having surgery. I mean, there's certain things you should and shouldn't do, and especially if you're sick, you shouldn't probably fly. If you've had surgery, I wouldn't think it's a smart idea to get and go off on a flight until you're really ready to go.
Yeah, we didn't get into it, but my goal is to select people. One of the biggest aspects of our patient selection is to ensure that people understand how medically important these surgeries are, because we often talk, we talk about the cosmetic aspects of it, and people tend to downplay all of the medical complications and implications
Yeah.
that come into play. And in the consultation, like my job after my consultant has done her incredible job of building up our practice and making you excited for surgery by the time you come in for consultation, my job is to do the exact opposite. I'm going to bring you back to earth. I'm going to talk about the risks of surgery. I'm going to make sure you know exactly what you're signing up for. And if despite that conversation, you still want to go forward, then it's probably a good sign that you're ready and you understand that this is a medical procedure that carries some medical weight to it as well.
Well, I think again that might be partially social media's fault too, and celebrities'
Yeah,
fault, because it almost sounds like, oh, you're just going in for Botox, right? And it's not. It's so
it
much
is not.
more involved than that. What do you
Mhm.
think? I mean, I love one thing I want people to know is that it's so amazing that you are still you're very much still into to learning, and
Mhm.
and even in the position that you're in, which is so fantastic to see that surgeons like yourself that are top tier surgeons are still going to conferences, they're still learning, they're still engaging with other surgeons, and seeing how you can still always perfect your technique. Where I think a lot of the
Mhm.
older surgeons, I feel like they're just stuck in sort of the way that
Yeah.
they've been doing it for years, and this is the way it goes. So, I mean, I have heard that argument before about, would you, go to a guy who's been doing it for, 30 years and 40 years, and he's got the track record. And I'm like, I'd rather go to somebody I think younger, who's like got new techniques, who's like a little bit, not to diss on older people, but I'm just thinking, for me, I think it's important that somebody really, really is up on the current trends and has that knowledge.
Wayne Gretzky was a great hockey player, but his tricks would never survive in today's
Yeah.
NHL. You know,
Good
the
analogy.
game moves faster. Information is disseminated so much faster today than it used to be in the past. Well, in the long past, surgeons would go to conferences and they were like symposiums where one guy would stand up with his one paper in hand and talk about his technique to 15 people in the room. And that's how information spread. The second generation was we would publish it in peer-reviewed journals. and a couple of thousand of people would read that, and that's how information spread. In today's day and age, we not only have social media, and I think people might know this or they might not, but we have large groups of surgeons who speak on a daily basis from around the world about things that work for them in their practice, and information is spreading faster than ever before. We are surgeons on steroids right now. And
Wow.
although I think that we cannot get better at what we do, I recognize fully that we will. And I think that's a really important aspect of, anything you do in life. If you think that you are the best, there is going to be somebody who
Somebody
will
better.
always replace you. Yep.
Yeah.
Because the goal is not to be the best. Someday somebody else will be the best. There is a Connor McDavid in today's day and world. There's no longer a Wayne Gretzky. The idea is to constantly aim to be the best and to try to perfect your craft, because again, there is something we are missing today, because we know that naturally it takes a long time to perfect what we do and how we do it. I talk a lot about how I marvel at the toaster. The toaster is, for me, like the greatest invention in the history of the world. Why? Because nobody has touched it in the last 50 years. It has the exact same technology, but they went through 100 different iterations
Oh my
before
God,
they
that's
got to
so
it, right?
interesting. The
You
toaster.
the
Yeah.
toaster. You can toast bread the exact same way if you toast 100 slices with the same toaster. And that's what we're always constantly striving to become. But the truth is, the human body is always evolving. Our techniques are always evolving. We will never become toasters, but we're always aiming to become a toaster, if that makes sense.
I absolutely love it. It's so
Yeah.
good. I'm gonna look at my toaster differently now.
I love the toaster. It's amazing.
Maybe even just explain about your clinic, what else your clinic does, because I know that it's
Hmm.
just not you. You have other things that you do at your clinic. So if people are in the area or in
Sure.
Toronto. So yeah, so tell everybody else or tell people like what it is you do in your clinic aside from amazing facelifts. And you,
Totally.
by the way, I just before you say that, I also wanted to say
Mhm.
that to everyone that Dr. Roskies, one thing I love about you, amongst a lot of things, is that you only do facial plastic surgery. So to
Correct.
me, that's important too, because I don't really want to go. I mean, not that guys aren't good at everything, but I would prefer that I'd go to somebody who really just that's what they do. They're not doing the BBL butt lifts and they're not doing the breasts and all that stuff. So you are really just a facial plastic
Yeah.
surgeon.
Yeah, it's not something that you dabble in. It's not like you do a little bit of body surgery, a little bit of facelift surgery. This is one of those things that you need to devote your entire career and craft into, because it is complex surgery. There is a whole psychosocial element, like we just talked about.
Yeah.
And if you're really looking for a transformational career as opposed to just a transactional one, there's nothing better than being a facelift surgeon, because
Wow.
your identity is tied in your face. And there is a whole element of pressure, not just to perform for your patients, but this is not body surgery that you can just, you know, tuck a hoodie on top of and hide
It's
from the
true.
rest of the world while you're healing. Like,
Yeah.
this is the type of work where, everything you do is on display for the world to see. So, I love that aspect of it. I think it also intensifies your relationship with your patients, because it takes a huge amount of trust to have somebody take a scalpel to your face. And when you do, and we both come out on the other side happy to talk about the story, I think it really creates a very strong bond between, you and your surgeon in ways that doesn't exist in other aspects of medicine. So it's a fun field to be
I
part
bet.
of, and I
Yeah.
love it. I really love it.
And so, you know what I was thinking when you were saying that about like, I often, when I get my hair cut or hair, I want to color my hair, but if I did color my hair, I often think how scary it is just to be a hairdresser. And then what you do,
Yeah.
I mean, I'm like, you've got somebody's hair in your hands and you're going to change it. And what if they don't like it? But what you do in itself, I mean, the courage and the bravery to be a reconstructive surgeon,
Thanks.
I think, yeah, you're right. It's a synergy between patient and doctor, and that's really, really important. So, doctor, one other thing, what is it that you guys do at your clinic in Toronto?
Yeah.
that besides what you do?
Totally. We do it in a abbreviated form now, but we're building a new practice just a couple blocks down in Yorkville. We're calling it Avum Health. Avum is Latin for timeless, and that clinic is going to be an ecosystem of self-care and wellness for many people who are entering kind of an era of their life that they want to define for themselves. That's kind of how we have positioned it all. Essentially, we want to be the four seasons of the med spa industry. So it's
I
going to be
like
this
it.
really, really beautiful clinic. Might be membership only. We're talking about it now, but it's all encompassing. When we talk about my facelift surgery population, it is not just their face that is um, an area of concern for them. We're talking about longevity. We're talking about hormone health. We're talking about even recovery from surgery, which plays into all of those aspects. So this is going to be a full scale approach to holistic care for my patient population, which is women in their 40s, 50s, 60s, and 70s who are entering a different phase of their life and who see these types of treatments as a form of self-care. And that's really what we want to provide to them. So in its current form right now, we have a recovery package that we allocate to every patient who has facial rejuvenation surgery with us. And, this might be something that I haven't said publicly, and it's hard for people to imagine because I'm this surgeon, but I really do love non-surgical treatments. I really believe in them, so long as the indication is correct and your provider is not selling you snake oil. So if there is a function for them, then they should be used. And we use them often when it comes to recovery from face and neck lift surgery, because when you do treat the skin after we've treated the face, then that's how you get the most beautiful results. That's when those really do shine through.
What do you think about red light therapy?
Love it. I
You
have one
do
sitting
love
right
it.
next to me here. Yeah,
You
I
love
do it every
it.
morning. Yeah.
I want to do red. I don't do it, but everybody's doing it, and I'm like, should I get one of those things, like those masks, or should you
Can
just
we
go to
can
an
we
infrared clinic?
No, listen, buy a panel for your home. My philosophy is the last thing we talked about. So we talked about when you're doing these treatments, we're examining whether treatment's good for you. You're talking about
Yeah.
what layer it affects, what's the indication of the treatment, what's the safety of the treatment, but also what are the drawbacks of doing it. And if the drawbacks are not very high, this is red light therapy. The only I would say risk in doing it is if it gives you some form of heat to your skin and you're prone to melasma or pigmentation of your skin, then you might not want to do it. But in general, if the drawbacks are so low and the benefits are unknown, then why not go for it? Tinker a little bit. I think as long as it doesn't set you back in any way, then I'm all for it. So I do my traditional sauna with my red light almost every single morning.
Some of these things work, it's things like that for health and longevity. Like I'm into peptides. I don't know what you think about peptides. I know that in
Mhm.
one of your Instagram posts, you did talk about HRT, and women coming in and whether or not they should stop HRT prior to surgery. That's an interesting perspective as well.
I learned a lot from people commenting on that post. To be perfectly honest,
Really?
I only know the extent to which it affects my facelift population, and that's why I dove deep into it. And there was a lot of misinformation about HRT. It started in 2002. There was a big study release that showed that, it could increase your incidence of breast cancer, and we actually know that to be the opposite now,
Yeah.
when you really look at the data. So, I learned from a lot of the comments on that post about how it affects women in general. And what I've come to understand is that there are just so many conversations that women are having that they feel not empowered to speak about publicly yet. And my job is to start that conversation, definitely not finish it, but at least to provide people with the resources or maybe even just the mind frame to approach it with some form of science and logic to be able to answer the questions that they might have.
Yeah. You know what I'd
Yeah.
love to do if it's that good for you? I would love
Hmm.
when we do air this, I think it would be really
Hmm.
great for people to write me and let me know what questions. And then we'll do like a 15, 20-minute follow
Love
up
that.
if people have any questions for you, because I know that it's going to give so many people food for thought. So
Cool.
we should do that and see, because I know so many people have questions and they just aren't getting the right answers. And so I think you're amazing, and thank you so
Thank
much,
you.
doctor,
Oh,
for being on this podcast. I'm
it's
so
my
excited.
pleasure,